Thank you.
Ms. DeGette.
Thank you. Well, just to reassure you, Ms. Stanley, if we ever did change the standard, we wouldn't do it overnight. Congress can't possibly move that quickly, so it would be some period of time for manufacturers to adjust. Mr. Lester, something you just said was really telling to me, and I think something we have to deal with as policymakers is it does us. I mean, we're all here to try to improve the lives of our constituents and consumers, and so the solution here really wouldn't be just to ban the use of these substances in toys manufactured in the United States, because as you point out, the vast majority of toys are now imported, and that's why we have to really that's why we really have to think about the risk and what we're going to do in general. And that's, I think, why the large toy manufacturers, as I was fleshing out with the last panel with Dr. Babbage, I think the reason the large toy manufacturers voluntarily stopped putting DIMP into toys is because they couldn't sell their toys internationally in other countries where they have stronger standards. And so don't you think we would need to have stronger standards for all toys that are distributed in the United States, not just toys that are manufactured in the United States?
Oh, without question. I think that the market has changed such, the global economy is such that it has to be both.
And if you, what we're trying to think about globally in terms of our new consumer product legislation that's in the conference committee right now, is we're trying to think about how we structure our statutes to deal with the shifting or the shift-add markets where we have so many imports coming in. Dr. Shetler, I wanted to follow up on a couple of questions Ms. Hooley was asking you about, because it is hard for us as policymakers to grapple with scientific studies and differing conclusions. What you're saying is that these studies that the CPSC is relying on are really studies that were based on that didn't look at the environmental data of these children and infants, correct?
That's correct.
And what you're saying is that there are other studies that you're relying on that when you looked at the environmental factors, there really were much more serious health hazards than the studies that the CPSC is relying on.
Well, what I'm saying is that I don't make the assumption that the child, the theoretical child in the risk assessment is empty of phthalates before sucking on the toy.
Now, what about Ms. Stanley's statement that the phthalates, at least certain types of them, do not, in the industry's opinion, do not get absorbed through the skin?
Well, I wasn't commenting on skin absorption. I do have opinions about skin absorption, but I was just simply saying that we can take a sample of children and take urine from them and measure phthalates in them. The Centers for Disease Control has done this, so we know that children are contaminated with mixtures of phthalates in the real world.
Okay,
all the time.
Not just through skin absorption.
Not just
from
all sources.
Okay. I thought it was interesting, and I'm thinking about this from a policy-making standpoint, what Dr. Babbage told me about, and actually this would be for you, Mr. Lester, as well, about what it would take for the Consumer Product Safety Commission to actually ban phthalates in these toys. And he went through all of the standards that we have at the CPSC. The industry did voluntarily leave DIMP out. But my question is, if you go through all of these CPSC standards and the current status of the scientific data, do you think that the threshold would be met under current law to have the CPSC ban these?
No, not for the same reasons Dr. Babbage concluded. It's unlikely because the authorizing legislation is so onerous that you need to demonstrate significant evidence of harm and do a cost-benefit analysis, and he named all the steps.
Do you think these are the correct standards that we should be looking at these substances in consumer products?
No, clearly not protective of public health.
Do you think these standards are more protective of industry than they would be of consumers?
Well, they clearly protect the product and the product manufacturers. That's perhaps even what they were intended to do. But from a public health perspective, the burden of proof is on the public or the legislature or the regulators to demonstrate harm, which is really not where it ought to be. Now, the Food and Drug Administration, in their pharmaceutical program, has a different burden of proof and a different set of thresholds that they need, but not in the consumer product safety.
When were those CPSC standards promulgated? Was it in the original enacting legislation for the CPSC?
I would assume so, but I'm not an expert on that legislation.
And my time has expired, but I'm wondering if you, Mr. Lester, Dr. Wilhite, and Ms. Stanley, any of you would be willing to supplement your testimony with any recommendations you may have as how we could modify the CPSC standards to be more in line with protecting consumers. Thank you. Thank you, Madam Chair.
I want to thank everyone. I would, without objection, just ask one more question of Ms. Stanley. Do you have any doubts about the safety of phthalates, and what would it take for you to be convinced that they are unsafe?
Well, I've managed this group, and I've seen them through research for, I'm coming up on 19 years now. So I've seen a lot of research conducted. I've seen the industry work as hard to develop just data that doesn't make it look any worse or any better.